Your knees hurt most the moment you try to get out of bed, and if nobody has ever explained to you exactly why that happens, I want to do that right now, because once you understand it, the fix becomes completely obvious. I am Dr. William, and this channel is dedicated to practical, evidence-based senior health. If you have not subscribed yet, do that now so you never miss what we cover. You have probably already watched a handful of videos on knee pain. Maybe you tried a few things. Maybe some of them helped a little, and maybe most of them did not. What I want to give you today is something different. Not just a tip list, but a real explanation of the chain reaction happening inside your knee every single night. And then the specific steps that interrupt it. Stay with me all the way through, because there is one thing toward the end that most people in their 60s and 70s have never been told, and it may be the most important piece of this entire conversation. Here is what you are going to walk away with. A clear picture of why morning knee pain happens, a 2-minute routine you can do before your feet ever touch the floor, and several natural strategies that address the actual root of the problem rather than just masking the symptoms. Now, here is something most people never consider. The worst part of your knee pain did not actually start when your alarm went off. It started hours earlier, somewhere around 2 or 3 in the morning, while you were completely asleep and had no idea anything was happening. Inside your body, there is an inflammatory molecule. Think of it as a chemical signal that your immune system uses to tell the body there is a problem. In people who have osteoarthritis or rheumatoid arthritis, that molecule spikes dramatically in the middle of the night. And right at that same window, your body's natural anti-inflammatory hormone, cortisol, is at its absolute lowest point of the entire day. Cortisol follows a daily rhythm, and it peaks around 8 in the morning. At 2 in the morning, it is merely bottomed out. So you have inflammation surging upward, and your natural protection against it nearly gone. And that combination is quietly doing damage while you sleep. On top of that, your knees rely on a fluid inside the joint, synovial fluid, that acts like a lubricant, keeping the surfaces smooth and separated. When you are not moving, especially if you have any form of arthritis, that fluid thickens up. It goes from being thin and slippery to something closer to cold honey. So when you finally swing your legs over the edge of the bed and try to stand up, your joints are stiff, swollen, and screaming. That is what happens when inflammation spikes. Natural protection drops, and joint fluid turns sluggish all at the same time. The good news is that you can interrupt all 3 of those things, and you can start doing it before you ever leave your bed. Here is the 2-minute morning routine I want you to try. You are still lying flat on your back, you have not sat up yet, and you are going to go through 3 simple movements. The first one is ankle pumps. Just flex your feet up and point them down, back and forth, for about 30 seconds. That sounds almost too simple, but what it actually does is activate the calf muscle, which acts like a pump for the blood and fluid in your lower leg, and that circulation starts working its way up toward the knee. After that, you move to heel slides. Bend one knee at a time, sliding your heels slowly up toward your body and then back down along the sheet. You are gently moving the knee joint through its range of motion while the joint fluid is still warm from being under the covers, which means it thickens less and moves more freely. And then the third movement is the quad set. Your quadriceps is the large muscle that runs along the top of your thigh, and it is the primary stabilizer of the knee joint. To do a quad set, you simply tighten that thigh muscle as hard as you comfortably can. Imagine pressing the back of your knee down into the mattress. Hold it for 5 seconds, release, rest a moment, and repeat that 6 times. Physical therapists use this exercise constantly because activating the quadricep pulls the kneecap into better alignment, reduces pressure on the joint surface, and gets blood moving through the tissue around the knee before any weight is placed on it. After those 3 movements, maybe 2 minutes total, you stand up, walk to the shower, and let warm water run directly over your knees for a few minutes. The warmth continues the job of thinning that synovial fluid and relaxing the tissue around the joint. And many people find that combination makes a dramatic difference in how their morning feels. It usually takes a few days of consistency before you really feel it clicking in, so give it a solid week before you judge it. Now, here is something that comes up in this conversation that almost nobody talks about, and I want you to pay close attention. Research in the area of rheumatoid arthritis has found certain bacteria inside knee joints that do not belong there. The surprising thing is where those bacteria appear to come from: the mouth. This is not theoretical. It is well documented enough that it has changed how some rheumatologists think about the disease. The way bacteria travel from the mouth into the bloodstream and eventually into the joints is usually through gum disease, deep infections under the gum line, or infections beneath teeth that have had root canals. A root canal, done correctly, is meant to remove the infected tissue, but sometimes an infection persists deeper in the bone beneath the tooth, and it is invisible without a specific type of panoramic X-ray. Many people have no pain at all from these hidden infections. They have no idea they are there. But the bacteria leaking from that site are circulating in the bloodstream and landing in places like the joints and the artery walls. I have had patients go see a biological dentist for this exact evaluation, get that panoramic X-ray, and discover that a section of the bone under an old root canal had been quietly dissolving from an infection they never felt. After treatment, several of them reported that joint stiffness they had carried for years began to ease up. I am not telling you that your knee pain is definitely coming from your mouth, but if you have unexplained arthritis and you have had root canals, it is genuinely worth asking a biological dentist to take a look. That is a stone that most doctors never think to turn over. Now let me talk about what you can do nutritionally to address that inflammatory molecule that spikes at night. The most well-studied natural option is turmeric, specifically the active compound inside it called curcumin. Curcumin has a strong ability to dampen the inflammatory signals that drive joint pain, and taking it before bed rather than in the morning may give your body a head start on controlling that nighttime inflammatory spike. Make sure you are getting a form that includes black pepper extract, because without it, your body absorbs very little of the curcumin. Some people find that adding a turmeric supplement to their evening routine is enough on its own to improve their sleep quality and reduce morning stiffness noticeably. Here is a light moment. I have heard from people who say they tried turmeric and it turned everything yellow, including their blender, their counter, and somehow their dog. All I can say is the trade-off is worth it. If that's happening to you, go ahead and hit the like button so I know I'm not alone in this. Vitamin D is another piece of this that I take seriously, especially for anyone dealing with an autoimmune condition like rheumatoid arthritis. People with autoimmune disease tend to need significantly more vitamin D than the general population to achieve the same effect. I generally look at dosing in the range of 10 to 30,000 international units of D3, depending on the individual. But I want to be clear that you should check with your own doctor before adjusting your vitamin D, because it is not a one-size situation. What I will say is that vitamin D without vitamin K2 is only half the picture. K2 is what directs calcium away from your soft tissues, your arteries, and your joints, and keeps it going to your bones where it belongs. Without K2, the calcium that vitamin D helps your body absorb can end up calcifying tissue it should not. The cofactor that makes both of them work better is magnesium. Magnesium also addresses something many older adults deal with constantly: nighttime leg cramps and muscle tightness. If you wake up with your calves seizing or your toes cramping, that is often a magnesium deficiency telling you something. Now for one of the most underestimated contributors to joint inflammation, and this one surprises people: blood sugar. Years of eating refined carbohydrates, white bread, crackers, sugary drinks, processed snacks drive chronically elevated insulin, and high insulin is pro-inflammatory in a very direct way. You do not have to overhaul your entire diet overnight. One of the most effective single changes is simply this: stop eating after dinner. Whatever time you finish your evening meal, let us say 6 or 7 in the evening, that is it. No snacking, no late night crackers, nothing. Water is fine. That overnight fast, even if it is only 12 to 13 hours, gives your insulin levels time to come back down, and many people notice less stiffness and less joint swelling within a week or two of doing just that one thing. Think of it this way: the water is your internal environment, your hormones, your blood sugar, your inflammatory signals, your sleep quality, your gut health. You can do everything else right, but if the water is polluted, the fish stays sick. The 2-minute morning routine, the turmeric, the vitamin D and K2, the magnesium, cutting the late snacking, these are all ways of cleaning the water. Now let me tell you something that the research on knee health keeps coming back to again and again. The single most therapeutic thing you can do for a damaged or arthritic knee is strengthen the muscles around it, particularly the quadriceps and the hamstrings. The knee is a hinge joint, and the muscles around it are its shock absorbers and stabilizers. When those muscles are weak, every step you take sends more impact directly into the joint. Strengthening them is not optional if you want lasting relief. It is the most important physical intervention there is. If you sit at a desk or in a chair for long stretches during the day, try this. Every hour, do a sit to stand. Stand up from your chair, sit back down, repeat as many times as you can manage. Even 5 or 10 repetitions every hour adds up significantly over a full day. If you can work up to 15 or 20, even better. A wall sit is also excellent. Stand with your back against a wall. Slide down until your thighs are roughly parallel to the floor, and hold that position until your legs are burning. It is not comfortable, but it is one of the most direct ways to build quad strength without putting impact on the knee. And here is one more thing that sounds a little strange until you try it: walking backwards. There is solid physical therapy research showing that walking in reverse changes the way your leg muscles fire, activates stabilizers in the knee that forward walking does not fully engage, and can reduce knee pain with regular practice. It also requires your brain to work in an unfamiliar way, which has its own benefits. Do it somewhere safe, your backyard, a quiet hallway, not the middle of a parking lot, and give it a few minutes a day. If someone sees you and gives you a look, just tell them your doctor recommended it, because one did. If you have significant cartilage wear in your knee, collagen supplementation is worth considering. Collagen provides the raw material that cartilage is made of, and there is evidence that supplementing with it can support the tissue around the joint. On the weight side of things, and I say this with full respect because I know this is not always easy to hear, every pound of body weight you carry adds several pounds of force across your knee with every step. Losing even 10 or 15 pounds can meaningfully reduce the mechanical load your knee is working against every single day. To bring it all together, your morning knee pain is not random. It is a predictable result of a nighttime inflammatory process that you can actively work against. The 2-minute in-bed routine addresses the immediate stiffness. Turmeric, vitamin D3, K2, and magnesium address the inflammatory environment. Cutting food after dinner addresses the blood sugar piece. Strengthening your quads addresses the structural weakness. And checking in with a biological dentist if you have a history of root canals and unexplained joint issues addresses a hidden factor most people never think about. One final thought before you go, and this one made me smile when I heard it from a patient. She said she used to dread getting out of bed every morning because the first 10 minutes felt like punishment. After 3 weeks of the morning routine and the turmeric, she said she woke up and just got up. She was so shocked she stood there for a full minute waiting for the pain to arrive. It never did. That is what this is about. If any part of today's video was helpful to you, please subscribe so you do not miss what is coming next. We go deep on topics that actually matter for this stage of life. And there is a lot more to cover. Drop a comment below and tell me what you want me to address next. Knee replacements, hip stiffness, nerve pain, whatever is on your mind. And please remember, Everything in this video is general health information, not personalized medical advice. Your situation is specific to you, and your doctor is the right person to guide your individual care. Talk to them before making significant changes, especially with supplements or dosing. Take care of those knees. You're going to need them for a long time yet.